Welcome to St. Tammany Health System, where we're excited to showcase our oncology program with you guys today. A couple of years ago, or maybe even a couple of decades ago, we started on a journey of really providing great oncology program to our community, and then expanded to our region. And as we expanded our services, we knew we needed a new model of care. We had outgrown the current model, so we partnered with Ochsner Health System to create the St. Tammany Cancer Center, where we became more of a regional cancer center, which wanted to provide some services we couldn't quite provide here on the campus. That included subspecialization. As we know, oncology has gotten very complicated, and specialization is important from a care perspective, and a multidisciplinary approach so we can get rid of those linear appointments and where you can see the whole patient, multiple specialties in one sitting, so that we can manage that diagnosis to treatment time much better than we had in the past. Also, part of our program, we wanted to add services that weren't just focused on medical components of the care or the treatment side, but we wanted to focus on the holistic side. So we also incorporated Integrative Oncology, which focuses on some of the mental and well-being parts that you may need as you go through your journey to diagnosis and obviously to treatment and survivorship, which is most importantly. So with that preface, let's go down the street and take a look at what we have in our new 75,000 square foot Partnership Cancer Center.
Thanks, Jack. My name is Renee. I'm the nurse practitioner in Integrative Oncology. Lagniappe in Louisiana means a little something extra, so that's why we call our services here in Integrative Oncology the Lagniappe services. We have many options for the patients. We have yoga, tai chi, meditation, music therapy, and support groups. We also have our dietitians, and they assist with the therapeutic food pantry, and we have our social workers who also assist with the therapeutic food pantry, in addition to any other social or support services that we can have. We have our boutique, which patients can go to for wigs. We have numerous different colors, different styles, and chemo beanies. We also have acupuncture, and we also have our oncology psychology support service that we can use, Dr. Lieberman and Dr. Tworick. Our navigation team is something we're super excited about here. They've been working on it for a long time, and we have 5 RNs who are site-specific navigators, and they work directly with our oncologists, and 2 lay navigators who do benign heme. So we're really excited about that. We're really excited about the idea that our patients can get all of their care in one place, and the patients seem to really enjoy that too. Next, we will meet Dr. Florence Wright in Radiation Oncology.
Thank you, Renee. I am Dr. Florence Wright, and I'm the radiation oncologist at the Cancer Center. The first thing that we do with our radiation treatment patients after we do consultation is treatment planning, and we have on-site exceptional imaging capabilities. So this is our CT scanner. It's shared with radiology, but we use it's set up to be our CT simulation scanner. And we also have a PET scanner right across the hall that's set up to do PET sims, which is incredibly unique in this area and is really fantastic for treatment planning, particularly for head and neck cancer patients and lung and a couple other sites. It's really wonderful to have them in the treatment position for their PET scan. As far as our CT simulator goes, we also have a capability called Align RT, which is a surface mapping system that uses these red pseudo-random scattered dots. There's almost like motion capture, like if you watched all the Lord of the Rings additional footage for 90 years. It's similar to motion capture technology, so it tracks the surface of the patient to make sure that the target is within range. If they take a deep breath or something like that, the machine will automatically turn off until they're back within the normal range where we would expect them to be for effective and safe treatment delivery. We treat our patients on a TrueBeam linear accelerator, which is a fantastic machine, and they spared no expense and got all the bells and whistles. One thing that is super exciting to me as a radiation nerd is that we have something called a 6 degree of freedom couch. So normally the couch on the machine is stable and it moves up towards the machine and down, and it rotates around in this axis so that you can, angle the machine different ways to angle the beams towards the tumor. the issue then is patient setup. So if the patient's sitting up a little higher than they were the day before, or a little bit rotated this way, or a little bit rotated that way, when you go to set them up, you have to go physically move them this way, or pull their blanket this way. And then you have to re-image them, and then go in and move them. You moved them a little too far, or their chin's a little higher, or a little lower. And sometimes you just have to take that uncertainty into account and treat a larger area. With the 6 degree of freedom couch, we can actually just make these little adjustments without going in the room. It saves so much time, and it's way more accurate, and it's just beautiful. When I'm checking the daily imaging, everything is on target. It's phenomenal. There's no like, oh, I'll just accept this. No, it's there, and it's right where it's supposed to be. Basically, we're treating all brain tumors with so we have stereotactic capabilities. We're doing stereotactic radiosurgery. We're doing SBRT, which is stereotactic body radiotherapy, and we're treating head to toe and skin. And the Cancer Center itself is very integrated. So we have a lot of multidisciplinary clinics. Every other Monday, I do a breast multidisciplinary clinic with the breast surgeon and the breast medical oncologist, where we all see patients at the same time. Today I have a prostate cancer multidisciplinary clinic, which we're still kind of setting up, but the patient sees the urologist, the medical oncologist, and the radiation oncologist essentially all the same day. And the medical oncologists are just right upstairs, and the infusion clinic's just right upstairs. So it's really just and you know, the imaging is here. So it's kind of a one-stop shop for most things, which I think is just really wonderful for patient care. So next we'll meet Christy right upstairs in our infusion suite.
I'm Christy Cessna, the RN manager of the Infusion Center. At the Infusion Center, we have 41 infusion chairs, 4 private rooms, and 2 injection chairs, all which are equipped to dump out the chemo, the waste, concealed with proper PPE. All the nurses are chemo bio certified. We have pharmacy on site. We also have a clinical oncology pharmacist that can come to the patient's chair for any questions or when they're a new start. The social workers and dietitians, the navigation team is all on site as well to help the patient through their journey. We have a nutrition center with chips, hummus, cheese, yogurt, applesauce, coffee, juice, anything the patient wants, along with puzzles, coloring books, a lending library, and then an outdoor patio for the patients to enjoy. This place is special because we have been working together for a really long time. We are family here and then treat our patients as family. Everyone, like I said, is certified. We do a daily huddle with all the patients and go over what the patient is receiving and also new treatment plans. The communication with the navigation team in the clinic is daily, all day. We have a triage response team. We schedule the patients by acuity and also by nurses, so the patients can receive that continuity of care with the same nurse at each infusion.
I hope you enjoyed our tour of our building, and especially our lanyap services. We're very excited about those services that we offer in that area, and really the social, psychosocial components that our team is working to help with our patients who go through there. As we know, cancer care doesn't just happen in one building or one place. It happens across the footprint, especially if you have a comprehensive program. One of those areas that we're super excited about is what we do at our Women's Pavilion, which is off campus. There, they're doing cutting-edge work that you'll hear about, from the diagnosis and treatment side to managing high-risk patients, to make sure that we can catch patients early on, because we know early detection and prevention are probably our best tools against the battle against cancer. So in addition to that, I know that obviously a hospital is very important to when you look at the continuum of cancer care. It's a combination of cancer center, it's off-site ambulatory, and it's the hospital where some care takes place. Hopefully you'll get a glimpse, and you will, of our inpatient unit and the great work they're doing up there to take care of our patients. Finally, I hope you enjoy a tour of our Bewell Bus and some of the work they're doing in our service area to help with screening, prevention, and education.
Hi, I'm Dr. Angela Bonagera at the St. Tammany Women's Pavilion, and I am so excited to talk to you about this new pioneering procedure we have for patients with breast cancer, and it's something called MagTrace. Part of the standard of most of the breast cancer surgery that we do is sampling the lymph nodes or removing the lymph nodes, taking them out to check to see if the cancer has spread there. The problem with this, even though we've transitioned over the years to less invasive types of surgery, the sentinel node biopsy. One of the problems is I'm disrupting the lymphatic system. So it's like busting pipes and blocking pipes. So that fluid backs up into the arm, makes the arm swell, and that is called lymphedema. We've learned about better procedures, and it's always better to do less surgery if you can. Now we have something even better than that. It's a pioneering thing that we are extremely excited about. We started it in the fall of last year in 2021, and it's something called MagTrace. And that's where we inject a iron-coated colloid particle in a liquid form into the breast, and this tracks, just like the old types did, and marks that lymph node. So we don't even have to take it out at all. We don't have to disrupt the lymphatics under the arm, because even though it was better to take out less lymph nodes, it's even better to not take out any. So that risk of swelling of the arm, lymphedema, injury to the nerves, that is obliterated if we don't have to take out that node. And this cannot be done for all cases, but there are some where we're able to not disrupt that system. And if we can do less surgery to help these patients and decrease that risk, that's what we want to do, and that's what this procedure does.
My name is Arlene Arsenault. I am the Director of Oncology Services here at St. Tammany. I also manage the infusion suite here at the hospital. So the medical oncology unit's on the 3rd floor. It's a 21-bed unit, all private rooms. We have the capability of doing inpatient chemo. We treat about 1,000 new, diagnose 1,000 new cancer patients each year. We offer services like UroNav, interventional radiology, robotic surgery. We also have EBIS and EUS on campus. Services like outpatient and inpatient hospice, outpatient and inpatient palliative care services. We have the capability of utilizing radiation therapy services in our area. We also have a case management team that's made of both RNs and social workers that help our cancer patients with their discharge planning. Our partnership with Ochsner and St. Tammany's Cancer Center allows us access to clinical trials. We also are very fortunate to have an outpatient infusion suite where we can provide blood transfusions, IVIG, antibiotic therapy. All those services allow our patient community, our cancer community, to stay here, right here in Covington, to receive world-class cancer care close to home. And now let's visit with Ann Pavlovich and our Bewell Bus.
Thanks. I'm Ann Pavlovich, Community Health Coordinator for St. Tammany Health System, and I'm here to tell you about our Bewell Bus. So the Bewell Bus is a really important part of our cancer program. We are able to get out into the community, bring critical screenings and services to the people where they live, work, and play. You'll see us out at employee health fairs, at community festivals and fairs, and even just at general rotations at all of our health clinics, providing mammography services, which is just an extension of our women's pavilion. We have the same technology, the same equipment, and the same fellowship-trained breast radiologists that are reading these images to provide a standard of care that is critical to our program. Well, we launched our mobile screening program just under a year ago, and we decided we no longer wanted to wait for patients to come to us to get their screenings. In fact, in October, we launched our United in Pink campaign, and we're able to provide 500 additional mammograms in the month of October alone, which is huge. It's a tremendous output from any month prior, and we're excited to do it again this year. But that's not all. We can offer skin cancer screenings, head and neck cancer screenings, colorectal cancer screenings, and education on all of these topics at community events for employers and their employees, anywhere out in the community.
Thank you for taking the time to view a couple of the things that we have in our cancer care program across our system and our partnership. We're excited about the things that we've accomplished in the past and give credit to the Commission on Cancer and accreditation process to help us with best practices and benchmarking some things that we could do to make us better every day. And we're even more excited about what the future holds as we grow our program and our screening and education programs in our community.